A diaper bank is a lot like a food bank. We take in donations of hygiene products, infant toddler diapers, period products, adult incontinence supplies, and then we get those back out into the community with the help of other local nonprofits, social service agencies, healthcare providers, shelters, anyone who is also helping families to meet another need at the same time. The data that the Data Plus students are working with come from the largest and first ever study to look at the outcomes of diaper banks across the entire country. And this is the first time we've ever had a very large data set to look at those benefits that families receive when they receive something from a diaper bank. And so the goal of this work is just the very first step in helping us to understand that role that diaper banks play in communities in terms of helping families to meet their most basic needs and to be able to participate in the community in ways that are meaningful for them. We're hoping that this project will help us to show legislators, donors, funders, supporters, the impact that they can make with their involvement in the diaper bank community.
Some of the insights we provide, like things like, one of our big things was how do people get to the diaper banks? I think they want to see in the future, what sites do we need to locate at? Like, do people drive? Do people take the bus? What do we need to locate by? And it's also going to be some things on like, they're very interested specifically in what's the impact of getting diapers on things like diaper rash and UTIs in children, and also when your kid like doesn't have diapers, do you have to miss work, and if so, how often? So a mixture of kind of quantifying the impact of diapers to show what they can do, and also things that'll let them better choose sites and better understand like how many diapers do we need, where do we need them in the future. And our job is to go through and help them create insights for the survey, both through a report and also through a dashboard we're going to build for them that'll let them kind of visualize whatever thing they want to see from that data.
A lot of the information that we got from the survey that we're working on really brings a lot of insight into this Durham community, especially low-income families going through diaper need. That's not something you see every day, not something you learn about, especially at Duke. So being able to connect and interact with that community around us, I think is really important.
We've been working, I meet with them maybe once or twice a week. We've been doing that the last few weeks. On their first day in the Data Plus program, they came out here and took a tour of the diaper bank so they could see a diaper bank in action, so they could better understand the work that we do day to day, to understand how the project that they're working on helps fit into the larger picture of the work that diaper banks do and the kind of goals that we have as a community.
Because a huge part of our project is data visualization, we're currently working on our dashboard using Dash in Python, and working with designing it, styling it, and making it a good service for our audiences to understand and make it just our complex data, being able to simplify that into our dashboard.
Our project is also part of like Plus Durham, or like it's like a pilot program, so I think it's really cool how we're like working with the North Carolina Diaper Bank, and like we're seeing our work kind of like in front of us. Like I think our work is more tangible, which has been really exciting, so that we've been able to like go to the diaper bank and see like what they've been doing. So I think it's made like the project closer to heart. So like we're putting like more effort into it, and we're just much more excited about it to be able to like actually see what's happening and like where this data is coming from.
How can we use the data to help increase access to hygiene products for families, whether through policies or program support for diaper banks or states that are helping to support diaper banks?
Yeah, I just wanted to be able to use like data science in a way that just can possibly benefit our Durham community.